How is it that the people on the front lines in the battle with COVID-19 are the lowest paid and least appreciated workers in the pandemic? Hello and welcome to the Unpublished Cafe. I'm Ed Hand. We're again coming to you from a remote location and practicing physical distancing to enhance safety. Long-term care and retirement homes are the hotspots still when it comes to the virus. More than half the COVID deaths in Canada have been in long-term care. More than 1 million Canadians receive home care. And here in Ontario, more than 130,000 people are personal support workers. As of Friday, 7 PSWs have died from COVID-19. The Ontario government has announced an inquiry into long-term care after the pandemic is contained. And to get a perspective on what's happening in the line of fire in those hotspots, we'll chat with one woman who is willing to tell us her story of contracting COVID-19 and her struggles to make it back. The Unpublished Cafe is allowing her to remain anonymous to protect her privacy and her job. And I want to thank you for joining us.
Thank you for having me here.
Well, I'm glad you could join us, and it's you're very brave for doing so. How are you feeling today?
I'm doing a lot better. No symptoms. I had two. Sorry, I'm having a brain fart. 2 swabs, just to see if I was good to go back. One was tested negative, which was the throat swab, and then I had a nasal swab, and they said that was detected, but at that point, they said I was shedding the dead virus, so I was able to go back. Now, I'm waiting on my work to see if I'm going to be going back to my client or not. Okay. I may not find out till Monday.
Okay. Let's go back a bit. When did you contract COVID-19?
I contacted COVID-19 when it was the 23rd of April when I first had symptoms. Mm-hmm. And I'm just trying to think here for a second. Sorry. I had chills, body aches, headache, joint pain, no fever. They said I had like a mild case of it, mm-hmm. So I was lucky. I had that for, I think till sometime in the beginning of this week. Beginning of May, and then I didn't have symptoms anymore.
A lot of those symptoms kind of sound like, the basic flu symptoms too, do they not?
Yeah, they do. But I was tested positive, so I caught the virus.
Obviously, when you were diagnosed with it, like before that, were you getting personal protective equipment at work?
No. They with my work, back in March something, I forget now. The company that merged with mine sent out a PDF to all the, saying that all the nurses were going to get PPE kits.
Right.
I thought, being a medical worker, part of all this, I would also be provided PPE kit, but that wasn't the case. I did ask for a PPE kit, and I was refused because I didn't have direct contact with anybody with the virus. Lo and behold, it seeps into my client's actual home, and my client got sick, and then I got sick. I'm not sure if other PSWs got sick. And then they provided PPE after I said that my client was having respiratory symptoms. And then it went through and got mailed to my apartment in Ottawa, which I can't access right now because I was on quarantine. I couldn't leave my, like where I'm staying with my parents just to try and avoid it. So I couldn't leave their property to get it. And well, I don't want to pass it around either. So
yeah. You're listening to the Unpublished Cafe. As we're chatting with one woman who's a personal support worker in Eastern Ontario, and she contracted COVID-19. We're hearing her firsthand experience getting back to work. And how long have you been a public service worker?
7 years.
Mm-hmm. What's a typical day for you at work?
As of right now, I was doing home care, and it was night shift. I had a client the last 4 years. I've been lucky with that. Not many PSWs get that opportunity. So I got to know my client, and they had a seizure long ago, which affected them over the years, and eventually they developed dementia. And so I was taking care of someone with dementia. It was like Lewy body dementia, and they still had sense of awareness and all that. But pretty much I was just there to make sure that they would sleep during the night and not to get up in the middle of the night and wander. And I just do personal care and make sure that they're comfortable and go back to sleep. Had a routine where they would sleep during the night, so they would be ready to get up in the morning. Over the years, they were declining, but it wasn't rapid till the weekend before I got sick. It was noted that they went through quite a rapid decline, and at one point they weren't themselves. Eventually, before I wasn't able to work my last shift with them, they seemed a little more themselves and weren't coughing as much, but they were very weak.
Tell me something. Do you fear going back to work?
A little bit, depending on the situation. If it's going to be with my clients, I'm not too worried because I know what they're like. But it's just I'll be dealing with them when they're really fragile. Now, if I'm not able to go back with my client, I'm worried that my work is going to assign me to long-term care homes, which I'm more worried about because of conditions with what they're dealing with right now and what they dealt with before the virus. I actually, when I studied as a PSW, my first placement was in a long-term care home, and it was just very negative environment, and I didn't like it at all.
Do you find it a little ironic that everyone's applauding the work of personal support workers now, yet, they're not willing to pay more for those people who are really on the front line?
Yes, I do find it's ironic. Like, I had some people before this virus hit, just regular folks. When they asked what my occupation was, I would say PSW, and they said, "Oh, you have a very hard job." So some people were aware of how hard my job was, but the government didn't really give a care with what we did. Like, I felt like we were pretty much a doormat to the Ministry of Health.
Considering everything that's happened, are you considering a career change or no?
I'm on the fence about that right now. Right. I do have a knack to take care of people, and I do seem to have a gift that not many have. So it's hard to know where direction I'm going in right now.
Now, you had mentioned that the province had sort of, left long-term care behind. You must be somewhat optimistic that the province is going to launch an inquiry into long-term care in the province when this is done.
A little bit, but I'm still very skeptical about it because before this virus happened, there were Ford was making cuts left, right, and center with and changes in our healthcare before all this happened, and like these changes she was making wasn't really helping the situation. And before that, like the Liberals actually, Wayne, when they also made cuts too, and a lot of PSWs actually got laid off during their term, and I had a hard time before I had my client. I had a hard time getting work because of budget reasons. Like the hospitals were very hesitant of getting extra PSW because of budget reasons. So I have to see where things go, but I'm very skeptical of it.
Well, I want to thank you for joining us and sharing your story, and we hope you all you get better very soon and are able to return to work.
Thank you for having me.
This leads to our unpublished .vote question. Should the private sector be removed from long-term care? Yes, no, or unsure. You can log on and vote right now at unpublished.vote. I want to thank our guest on the Unpublished Cafe for sharing her COVID-19 story and an eye-opening view on the world of PSWs. And I want to thank you for listening to the Unpublished Cafe. Stay safe. I'm Ed Hand.